So today we've got Dr. Al Danenberg. Now I call him Dr. Al because my community knows that the root word of doctor is docere. It's the Latin and it means teacher. And boy, can this man teach. He's had a history of teaching. He's got so many different content and blogs on his website. So I'm going to encourage you at the end when we give him, the community, the social handles and his email. He's a true teacher. He's been in private practice as a periodontist for 44 years, and why he's got a story that I want everyone to hear. So welcome to the show, Dr. Al Danenberg.
Well, thank you. It is an absolute privilege to be here, and thanks for the opportunity.
Pleasure. Well, let's start with your nutshell backstory, because I think people are going to learn a lot. You were a traditional dental surgeon, possibly a traditional periodontist for many years, and then something happened.
Oh my God, lots of stuff happened. So I am 73 years old now. I got out of dental school and graduate periodontal school in the early 1970s. That's a long time ago. Most of your viewers have not been born yet. I get it. So when I was practicing dentistry and learning dentistry, I learned the way of dentists conventionally. I did all the terrible things that dentists do, putting amalgams in teeth, doing root canals, treating periodontal disease with very invasive surgery. All that I did, unfortunately. When I was a graduate student and specialized in periodontics, of course, I only did periodontal treatment or gum treatment. But I did that for 44 years until September 2018, when some terrible things happened to me. But that's not when bad things started to happen. I was 71 at that time. Actually, it started to happen, bad things started to happen when I was 59 years old. When I was 59, I had a stroke. Oh my God, I thought I was a healthy guy. Now, I lived like all my contemporaries lived. I ate lots of carbohydrates. I was 187 pounds. I'm only 5'7", so I was a little chunky. Didn't realize any of these things that were going on. So I had a stroke. And my conventional medical doctors saved my life, put me on 7 medicines for the rest of my life, but that didn't sit very well with me. So I started asking questions. Now, I asked the questions from my doctors and said, why did I have a stroke and what can I do to prevent the stroke? They didn't really know why I had the stroke, except that they said that my carotid artery on my left side was kind of twisted congenitally, and that's what created the stroke. But they said, just eat a healthy diet and exercise. Well, what did that mean? So I went to the American Heart Association, the American Diabetic Association, the American Cancer Society, looking for healthy diets and healthy lifestyle so I could change my life. And I followed their recommendations from the age of 59 to 66. I maybe lost 4 or 5 pounds, still was on 7 medications. But at the age of 66, I found a course at the Kripalu Center for Yoga and Health. It's a big yoga center here in the United States. Very, very well known. But they were offering a 5-day course, intensive course about nutrition that was given by maybe 5 or 6 very well-known nutritional physicians. So I took the course thinking it was only going to confirm everything that I was learning from all these medical organizations. But lo and behold, they taught Paleolithic lifestyle and diet, terms that I never heard of. It blew me away. It made so much sense that when I finished the 5-day course and called my wife that I was coming home, I told her that I'd like to make some changes. So when I got back home, we bumped heads for a little while, and she gave me 30 days to try it. So we removed all of the non-paleo type foods, the carbohydrates, the sugars, processed seed oils, just processed foods. All of that stuff we removed from our pantry, our freezer, our refrigerator, put it in 7 grocery bags that we took to the food bank. we had no food in the house. So at that time, I learned about how to buy pastured meat. I learned how to buy fruits and vegetables and nuts and seeds, all organic. And we started this new type of diet. Well, from the age of 66 to 68, I lost over 35 pounds without even trying to lose weight. You know, you balance your hormones, everything gets healthier. All that excess fat just disappears. And I was able to literally remove all 7 medications from my regimen, all 7 medications.
Wow.
Amazing. So when I was 68 years old, I'm thinking I am the senior poster boy for a healthy lifestyle. So I'm incorporating all these concepts at the age of 68 into my periodontal treatment, changed everything I was doing. I started 7 years ago, before I was 60, maybe in the 60, around 60, 61 years old. I started to use laser therapy for periodontal treatment. Got phenomenal results. Stopped doing other conventional periodontal surgery. Very, very excellent results. But now that I incorporated the concepts of a paleo diet and a paleo lifestyle, those patients that actually were interested in this nutritional idea did amazingly well. They healed well. Their other chronic diseases seemed to get better. It was an amazing, amazing story. So I started writing, lecturing, doing seminars, virtual consultations. And then let's fast forward to April 2018. I'm 71 years old. And I was asked to speak at the Paleo FX meeting in Austin, Texas, in the United States. I live in Charleston, South Carolina, so I have to travel, take an airplane, and then change planes, take another airplane. And usually when I change planes, there's a lot of walking from one concourse to another. So I carry my luggage bag on my right shoulder. And never a problem. But this time, my right shoulder got very, very sore. Went to Austin, did my speech, got back to Charleston, and the soreness just never went away. I thought I tore a rotator cuff or something, and it got worse. Eventually, it went to my back, and then it went to my chest, and actually, I started having problems taking deep breaths. So I'm a little pig-headed, so by August of 2018 now, I figure I need to see my physician, who I've seen for over 25 years. So I go to him and I talk to him about what's going on. He says, yeah, there's some problems here. Let's do some blood tests, basic CBC, basic chemistries. They were relatively all normal, all within normal ranges at least. But he did a CRP, a C-reactive protein test, and that indicated that I had quite a bit of systemic inflammation, and I never have that high of a result in a C-reactive protein. So he orders an MRI to figure out what's going on. Now he gets the MRI and he calls me and he says, Al, do you want to come into the office? You want to speak on the phone? I said, of course, let's speak on the phone. How bad could it be? So he starts to joke around and he says, did you get in a fight or did you fall down some stairs? And I said, of course not. I have this sore shoulder and now it's causing me some trouble breathing. And he said, and he gets very serious and he says, well, I see a vertebral compression fracture. I see a soft tissue mass on the side of your spine, about 2 to 3 centimeters big. He says there are several broken ribs and a hairline fracture in your pelvis. And then he says, I think you have leukemia, lymphoma, or multiple myeloma.
Wow.
Wow. Here I am thinking I'm the senior poster boy for a healthy lifestyle. I feel great, except what's going on in my shoulder that's spread to my chest. And now I'm given a differential diagnosis of 3 cancers.
Sure.
My life is just crumbling around me. So he makes a referral to an oncologist who I don't know yet. The oncologist orders a variety of tests before I even see him, a biopsy of the soft tissue mass, a CT scan, a PET to look at where the cancer cells are, and a whole bunch of other chemistry tests. And I go to the office with my wife and my adult children, And he tells me, after he goes over all the data from the tests, he tells me that I have IgA kappa, light chain multiple myeloma, with severe lytic lesions, little holes throughout my entire skeleton, like a person with severe osteoporosis. That's why I'm having all these pathological fractures. Then he tells me this is incurable. And then he tells me I have 3 to 6 months to live if I don't do anything.
Wow.
Now, there's a ton of bricks that just dropped on my head. It's like I was just T-boned by an 18-wheel truck. And I figure my life is over as I know it. So he tells me tomorrow, the next day, I need to start chemotherapy. I'm not a good candidate for stem cell therapy. We can do some radiation, he says, on my chest. It won't stop the disease, but at least it'll stop the pain and I'll be able to breathe without difficulty. So I'm asking him now, I'm thinking of all these questions to ask him, and I'm asking him, well, why would I do chemotherapy if this is incurable? And he says, well, chemotherapy is going to put you in remission. And if you're in remission, you'll be fine until it comes back. When it comes back, which we'll do, you'll need more caustic chemotherapy because the original chemotherapy would be no longer effective. And then you'll go into a remission again. But eventually, none of the chemotherapy will work any longer. And you're going to die from the complications of multiple myeloma. This is a terrible discussion right now. So I'm asking him, again, I'm kind of geeky and I need to know, well, how am I going to die? And he tells me, well, patients that have multiple myeloma generally die from an infection that they can't get under control because the immune system is so shot, or a kidney malfunction, and that would kill me. Or I would bleed to death because the anemia would be so severe because of the red blood cells getting all destroyed. Those would be the 3 major causes of death. So I'm telling him, look, right now, I just have pain in my chest. I feel great other than that. I can't understand why I would go through chemotherapy and decrease the quality of my life going forward and then die from this disease. I need to make some other decisions. So I agree with the radiation, and I need to investigate other unconventional cancer protocols to boost my immune system, not destroy it from these chemicals. And he agrees with me, and I start to investigate and create these protocols, and I get involved with them, and I do relatively well for a year. I'm not getting worse. I'm not getting better. The chemistries are staying the same. The blood work, all the other things are staying the same. And then let's fast forward a year from then. I've outlived my prognosis, and it's August of 2019. August 2019, I've had a couple pathological fractures. I've healed from them, and now I'm standing in my bathroom, brushing and flossing my teeth, and I know how to do that pretty well. And I realize that I can't bend or things do trauma to my skeleton. But I have to throw my dental floss away in the trash can, which is to my left. So I twist about 90 degrees to the left. My feet are planted on the floor. When I twist, my right femur snaps in half. I crash to the bathroom floor. I break 2 more ribs, and I fracture my right humerus in half. I am literally lying on the floor, writhing in pain, really can't move. I know I'm in really bad shape because I can see my arm and leg at angles that they could never bend. And I'm screaming for my wife, who's in the other room. She comes running, and obviously quite an emotional experience right then. She calls EMS, emergency services. They get me out of the bathroom on a gurney, get me to the hospital. I realize the quality of my life is over. That's what I'm thinking. And I'm ready to die. And I want to die. I really want to die. This is over for me. So they get me to the hospital. They fix my right femur because it's ready to perforate the femoral artery, or I would have bled to death. And then they don't fix my right shoulder. They put me on all kinds of narcotic medications. I'm catheterized. I am absolutely miserable. And I reject everything else they want to do for me. And they send me to a hospice hospital to die. Now, this is the beginning of April 2019. I'm there in the hospital for a week or so, and there's a hurricane coming to Charleston, South Carolina, that is only moving at 1 mile an hour, but it has 187-mile-an-hour winds. And it's predicted to strike right near the hospital. And the hospital is ordered to evacuate all their patients. They have no idea where to send me. My wife's a nurse, so she arranges for a hospital bed in the house, and they send me to the house. I'm catheterized. I'm still in hospice. I'm highly drugged, and I'm in this hospital bed. Once the hurricane goes through, the area, my wife gives me a little tough love, actually a lot of tough love. And she's literally psychologically beating me over the head and says, look, you're not a victim, you're a survivor. You did so well with these unconventional cancer protocols. Never put you in remission, but you did extremely well. Let's get you back on these protocols. Let me get a physical therapist in. Let's see what they can do to help you. So the physical therapist comes in, he works with me, he gets me to sit up in bed. Eventually I stand up. Eventually the catheter comes out, which I've had for 30 days. You cannot imagine what it's like. Yeah. I start to wean off all the narcotics. That's a very process for me. And I start walking with a walker, and I'm really starting to rally, getting back on my protocols. And I get to the point where the next month, October, I can literally go to my oncologist. Now, he is amazed that I'm still alive. So I see him, he talks to me. He says there's some new drugs that were just approved by the FDA here in the United States that helps, not chemotherapy, but is immunotherapy to help support my immune system and kill some of the malignant plasma cells, of which this is multiple myeloma. So I get on that. I incorporate that with my unconventional cancer protocols. And then come May of 2020, and I'm doing very well, come May of 2020, he wants me to get a new PET scan to see how my cancer cells are. So May 8th, we do that. And he calls me that evening, and he says, get your wife on speaker. And he reads the radiology report. It says, no active cancer cells visible on the PET scan. Wow. That is amazing. I am floating. My wife is crying. As soon as I come back to earth and I ask him, George, just reread that. Make sure I'm hearing you right. He says, yes, there are no active cancer cells visible on the PET scan. Now, in reality, a PET scan only shows moderate to large clumps of cancer cells, so it doesn't show everything. So I'm not in remission. I am not cured from cancer, but I'm doing amazingly well.
Yeah, fantastic.
And that's where I am today.
What an incredible story, of someone who just never gave up. And you were more concerned about health span than lifespan. I mean, everybody wants quality, don't they? We don't want to be sick and extend this life, with these type of Western medical treatments that we might get a better sort of lifespan, but we lose the quality. Isn't that right?
I go to the cancer clinic every month, and I see people that are doing well, but I see a lot of people in the infusion clinic where they're getting their chemotherapy. They look miserable. They don't act like they're having a good time with life. This is not the way I want to extend my years. I had no problem dying. I am not religious, but I am extremely spiritual. Yeah. I feel that we have a place on this earth and we have lessons to learn. And when it's my time, I'm ready. So I'm ready to die. I just want to die like I feel today and then just drop dead tomorrow. I mean, that's perfect. That's the way I want to go. I don't want to be debilitated like I see so many cancer patients getting as they get closer and closer to death. It's just not the way I want to live my life.
Now, you're very measured. Obviously, you understand the PET scan, and for the audience or for the the ones watching on YouTube, is it shows glucose metabolism, so glycolytic activity. And knowing Thomas Seyfried's work and looking at cancer as a metabolic, dysfunction with the mitochondria. Obviously, they use glutamine as well, cancer cells, so you quite sort of measured with regards to what's going to happen to your cancer. But you did change your nutritional lifestyle significantly, and you had a really good podcast with Dr. Saladino, which I'm going to link to in the show notes. But tell us about this this diet that has been sort of shaking the world a little bit, that you've adopted, and I think it's really what helped you in your cancer.
Without a doubt. I must tell you that each of my protocols, I think, contribute to the success of my immune system. So I can't tell you one is that much better, but I think they're all integrated to literally, like a shotgun approach, do different things in a very positive way. So when I was diagnosed with my cancer, I was already on a paleo diet. I switched from a paleo diet to a paleo autoimmune diet, meaning that I got rid of all the nightshades and dairy products. And so at that point in time, I was doing well, but I did more research as far as metabolic health. And I came across a clinic in Budapest, Hungary, called the Paleomedicina Clinic. And the Paleomedicina Clinic has been in existence, I think, since 2011. They've treated over 5,000 patients, and the patients that they treat have severe chronic disease as well as cancers. And they treat their patients with a very strict animal-based diet, which they call the Paleolithic ketogenic diet. And it has a fat to protein ratio measured in grams of 2 to 1. Now, that diet is exclusive of that's their exclusive element of treatment. They do not use supplements, and they do not use pharmaceutical medications. So they have treated many, many patients, like I said, at about 5,000, and they do case reports that they publish. And I kind of filter out all these cancer patients, because that's what I'm really interested in. And the results are amazing and compelling. Sometimes they get remission, sometimes they don't. But all of the signs and symptoms of active cancer go away. There was a very recent study that they published maybe 5 or 6 months ago about a gentleman in his 50s that had glioblastoma. It's a very severe cancer of the brain. It is a death sentence. Everybody dies from glioblastoma, and they die very, very quickly. So this guy was diagnosed and conventionally was treated with chemotherapy, radiation, and surgery. He went into remission for 2 months. The disease came back, all the symptoms came back, and he refused more conventional oncology or cancer treatment. He went to the Paleomedicina Clinic. They put him on the strict animal diet, no meds, no supplements. And after 6 years or so, something like that, they reported, maybe not that long, they reported his success story. And it's amazing. He was not in remission, but all the symptoms, all the signs went away. He was functioning as a normal human being. This is amazing. This is glioblastoma. So this is just one of many cancer reports that they publish. Now, these are not double-blind studies. There are a lot of naysayers in the medical community, but here I am, a subject of N equals 1. I am not going to wait 20 years for medical science to prove beyond a shadow of a doubt a carnivore diet is going to cure cancer. Mm-hmm. I am going to jump right on, because 20 years from now, I wouldn't be alive. So I am incorporating the carnivore diet, and I started with it very strictly on January 1st, 2020. It's been over a year now that I've been on the diet. It does wonders for me. I know I'm in ketosis because I use a breath ketone meter. I know my glycemic variability is extremely healthy because I've done a continuous glucose monitor for a 2-week period of time and understand my standard deviation, which is 10. an unbelievable standard deviation. Anything that is 14 is ideal. I'm only 10. What I'm saying is, I believe my metabolic function is at peak performance today, better than 98% of the population out there. And here I am dying from multiple myeloma with tremendous support for my immune system. So I think the diet is absolutely critical.
Great, and we're going to jump in later in the podcast looking at the ketogenic diet and looking at the carnivore diet, how to measure ketones and CGM. I really want to look into that because I think there's a lot of people who don't know about how to sort of measure their glucose, measure their ketones. Why are these diets so important? But I do want to just start with what is biological dentistry as a question, and I'll tell you why. I've had Dr. Dom Nishvitz on the podcast, which was, really, really good. Interview my own biological.
He's a great guy. I actually did a FaceTime with him a few months ago, and he's a phenomenal guy.
Yeah, phenomenal guy. Great book. It's all in your mouth, and we'll link in the show notes to the book and to the podcast that I did with him. And then I'm interviewing my own biological dentist on Saturday here, because biological dentistry in South Africa and Africa is really, it's not well known. People don't understand it. It's very frowned upon in terms of what a biological dentist is. And it's difficult to be a pioneer in the dental field with regards to biological dentistry. So in your own words, Dr. Al, what is biological dentistry?
Well, it's just amazing that you have to say biological dentistry. I mean, dentistry, medicine, it all should be biological. Why do people not understand that one cell in the body communicates with every other cell eventually and has an effect? I just don't understand that. So what biological dentistry is, sadly, it's not a specialty. So any dentist in the United States who has a license to practice dentistry without any knowledge of biological concepts can call himself a biological dentist or a holistic dentist, because these are not legal terms and they are not licensed. So they can say these things, unfortunately. But a biologically oriented dentist has taken many postgraduate courses, because it's not taught in dental school, and understands that the materials that are used in dentistry may have chemicals that affect the rest of the body. And they need to test the rest of the body to see if they may be sensitive to these chemicals. In addition, they understand, or they should understand, everything that happens in the mouth affects the rest of the body, and everything that happens in the body is mirrored in the mouth. Now, unfortunately, most biological dentists, not all, but most biological dentists believe that everything, infections and inflammation, start in the mouth and literally go through the systemic circulation to affect other parts of the body. That is only 50% correct. And those biological dentists think that the germ theory is alive and well, meaning that bugs, bacteria, microbes in the mouth are causing disease and they must be destroyed. That's absolutely incorrect. So let me give you an idea if you want. You want me to
Absolutely, go.
tell you that? So all the research I have done, and I've done quite a bit of research, very clearly shows that the immune system is critical to overall health. And the immune system is dictated by the garden of bacteria in the gut. We have 38 trillion microbes in our body. The majority are in the gut. And we only have 30 trillion human cells. We're more bugs than human. And these bacteria do wonderful things for our body. And when they're in a state of balance, and there are thousands of species, when they're in a state of balance, they allow and communicate with the immune system to function properly. They talk to the immune system. There are so many bacterial cells and only 100,000 or so immune cells. So they communicate and let the immune system know where the body is being invaded in any and every mucosal tissue of the body. It talks to the immune system that's lining the gut. 70 to 80% of our immune system is in the gut. And then it goes to work. Now, when the bacteria are not in a state of balance, something happens and pathogenic bacteria overgrow because of a poor diet. Maybe over-exercise and oxidative stress, maybe under-exercise, maybe emotional stress, maybe dirty electromagnetic fields that you and I are talking through right now, maybe poor sleep habits. There's so many factors that can disturb the healthy gut microbiome. But if that gets disturbed, it affects the immune system. It causes holes to form in the epithelial barrier of the gut, and junk that normally would stay in the gut and eventually get excreted through the rectum get leaked into the blood system. When that happens, everything goes haywire. It's called metabolic endotoxemia. It's infection and inflammation in the blood system. Sometimes it's slight, sometimes it's severe, but it can go into every organ system in the body, including the mouth. And it changes the ability of the immune system to function, and it changes the complexity of bacteria in the mouth. So we have possibly 700 species of bacteria in the mouth. Everybody has maybe 200 or 300 of their own bacteria. Everybody's bacteria is very unique, that the composition is unique. When the change occurs, when the immune system is compromised and different pathogenic bacteria overgrow because of a weak immune system, bad foods feed these pathogenic bacteria, and all hell breaks loose in the mouth. And then it can spread through the rest of the body. But here's one very critical element. The tooth is the only structure in the body where a hard structure penetrates the epithelial tissue and embeds itself in sterile bone. Think about it. It's a sliding board. If you have bacteria around it, it can slide from the tooth into the sterile bone and create necrosis in the bone. You'll lose your jaw. You'll die. So the body has created many methods to protect it. Under the gum, there are all kinds of immune system cells to wreak havoc with pathogenic bacteria that want to enter the area. But there is a first line of defense, which is a natural biofilm that surrounds this crevice where the tooth pierces the gum and embeds itself in the bone. And it's called dental plaque. Dental plaque is healthy. You don't want to remove it. Dental plaque has three main functions. It's made up of 200 or 300 species of microbes. They produce hydrogen peroxide. That peroxide literally kills other potential pathogenic bacteria living in the mouth and the saliva that want to get into this crevice between the tooth and the gum. It literally kills them. It also has chemical buffers that protect the acid from going below a pH of 5.5. So it protects the root from tooth decay. And it also is the gatekeeper, allowing minerals from the saliva that pours out in the mouth 24 hours a day, 7 days a week. It allows these minerals to penetrate its surface and get into the root to remineralize the root surface of the tooth to keep it strong. So this is a protective barrier. So what do dentists want to do? They want to not only clean it off, which is not a big deal because the pellicle, which is the first layer of the plaque, forms every 12 hours. But they don't just clean it off. They prescribe antimicrobial toothpastes. They prescribe antimicrobial mouthwashes. They prescribe chemicals like xylitol that prevent the pellicle from forming. They want to remove all of this dental plaque. They tell children to use these disclosing tablets that dye the dental plaque red, and they're told to scrub it until all the red goes away. In other words, scrub that harmful dental plaque away. Well, the harmful dental plaque isn't harmful unless it gets overly infected with pathogenic bacteria, and that's a different story, and we can talk about that. But if you have a healthy gut and you have a healthy diet, that dental plaque is healthy, and it serves a very important biological function. So I'm not sure I got to answer your question, but a biological dentist needs to understand that the gut microbiome affects the mouth microbiome, and it must stay healthy. And if it's not, we need to reduce the infection in the mouth. And we can do that with antimicrobials, but short term, a week to 10 days, and then rebuild the gut microbiome and the mouth microbiome. We don't want to kill the bacteria 24 hours a day, 7 days a week with all kinds of artificial structures. And of course, we want to fix teeth that with materials that are not toxic to the body.
So well said and so well summarized, because I think we become bacterial sort of phobes. You know, we just want to kill bacteria with a whole antibiotic sort of move. We think bacteria are good. I mean, bad. That's the thinking. But bacteria are good and bad. They need the balance and they need the homeostasis to be correct. And tell us about Weston Price, because you know, he did a lot of studies and embellished on the thought of the diet. And, you know, did these people that he studied brush their teeth and floss their teeth and use mouthwash? What did he find?
So, you know, it's interesting. Weston Price is not taught in dental school. I don't get that either. So this guy, who was the president of a dental association in his day, went on a tour of all kinds of places outside the United States. It was all observational, but he saw that the peoples that ate foods that were raised and grown on the land without contamination had very healthy mouths. And he saw that people that ate processed foods had very unhealthy mouths. They had crowded teeth. They had all kinds of decay and gum disease. It was a pathetic sight. And he understood that diet and saturated fat and fat-soluble vitamins and vitamin D, all of these factors contributed to a very healthy mouth, a healthy jaw, a healthy tooth position. All of these things were true, and he reported that and wrote it in a phenomenal book. I can't remember the title, but it was a phenomenal book. So Weston A. Price gave the medical profession an understanding that environment, epigenetics, is critical for health. It's just not been embraced for some reason by the dental world, by the medical world. It's not part of medical and dental training, which it should be.
Absolutely. And I mean, these folk, from what I know, I've read the book Nourishing Traditions as well by Sadie Fallon, saying they weren't brushing their teeth, they weren't flossing, they didn't have all this, you know, mouth sort of treatment every single day.
Well, all we have to do is look at human jaw remains from 10 to 20,000 years ago. First of all, they didn't have toothbrushes, they didn't have dental floss, they didn't have chemicals, they didn't have a dental cave to go to get fluoride treatments. Yet, when we look at their jaws, we see relatively healthy jawbone, meaning they didn't have gum disease. We see relatively healthy teeth that are not decayed. They are very badly worn. Some are broken, but they are not decayed. But we also see a line of calcified material between the root of the tooth and the bone, which is actually soft dental plaque that has calcified to tartar, or what we call calculus. And this is a normal dental plaque that has calcified, not causing tooth decay, not causing gum disease. They didn't have to remove it. And I'm not so sure brushing and flossing is critical if you are metabolically healthy with a good diet. I will tell you that I don't think in westernized, civilized worlds that exists. So everybody has to brush and floss correctly, and we can talk about that. But you only want to clean unhealthy dental plaque off, not the healthy dental plaque.
Why don't you just sort of summarize what's the difference between unhealthy dental plaque and healthy? Because I'm sure I'm going to get a lot of questions from people saying, you know what, the narrative is that plaque is totally unhealthy.
Sure.
You've got to remove it. What is the difference, Doc?
So first of all, the dental plaque, like I said, protective biofilm. If the gut microbiome is unhealthy and the diet is unhealthy, pathogenic bacteria start to grow and thicken on the dental plaque, and it starts to maybe have an odor, maybe look like Swiss cheese because it's getting very thick, and certainly the gum tissues look redder. And if you clean between the teeth with a little device called an interdental cleaner, one of them that I really love is called the TP Easy Pick, TEPE Easy Pick. It's like a toothpick, but it's silicone, doesn't cause damage. But if you clean between the teeth at the tooth and gum line, like you would move in and out with a tooth, any bleeding, that's a sign of gum inflammation. That's a sign that you have dental plaque. And that is a perfect sign to me that you have gut dysbiosis, unless there is iatrogenic or bad dentistry in the mouth that is irritating the gum because of, or a bad filling that is sharp and not properly formed around the tooth. It's irritating the gum, accumulating debris underneath of the bad filling. But if bad dentistry in the mouth, eating, it is the sign of unhealthy dental, but also a sign of dysbiosis and a compromised immune system.
Right. Tell us about your daily dental routine then. If we're not supposed to be brushing that often, or what we're supposed to be brushing with. I use essential oils to brush my teeth. I don't try and brush too hard. I'm very, very gentle with my floss. I'm still a sort of a student when it comes to dental hygiene, but I do understand we don't want to kill these bacteria and we want to be quite gentle with our teeth. But tell us about your daily routine, Doc.
Let me just tell you what with essential oils, an indiscriminate microbial, it's going to kill good bacteria. I would never do that. I would never brush my teeth with any antimicrobial anything on a daily basis. Now, how do you brush your teeth? Well, you have to brush your teeth because you want to get rid of any excess bacteria that would be accumulating. You want to clean between the teeth, and here's how you do it. You take a toothbrush. I'm a little lazy, so I like the electric toothbrushes. These are soft bristles. They won't damage anything in the gum. And you put the bristles at a 45-degree angle where the tooth meets the gum on the cheek side and the tongue side. And you turn the electric brush on, and it wiggles or has circular motion depending on the type of brush you're using. And it literally removes the unhealthy, if there is unhealthy, excess dental plaque. It's not going to remove the pellicle. It's not going to scrub the tooth so clean that it is devoid of the dental plaque. That is all you need to do. Now, you can dip the toothbrush in some salt water. You can dip it in a little coconut oil and a little baking soda if you want to get a little more aggressive. You can use gentle, the toothpaste, Revitin. It's basically a very holistic particles that are going to disturb the microbiome or kill the microbiome, really help invigorate the mouth. It has a very nice flavor. I'm working with the company, and we're creating a protocol to see if Revitin will actually change dysbiotic plaque into healthy plaque over a period of 4 weeks, but that's in the process. But this is a good toothpaste. You can literally swallow it. It's not going to harm you at all. But you do not need to use and should not use any commercial toothpaste. You should not use any toothpaste that are loaded with essential oils. You should not use toothpaste that's loaded with activated charcoal or bentonite clay. These are binders. It sucks up minerals that are in the area. All you need to do is the mechanical cleaning of the toothbrush. And if you only wanted to use salt water, that's fine. Now, you won't be able to clean between the teeth with the toothbrush. So you need to use these little picks that are perfect to clean where the gum meets the tooth. These are called TP Easy Picks. They're very resilient. They can bend and recoil so that they don't then break. And what you do is work them in and out surface, and see any bleeding whatsoever, you have infection. You also can use dental floss, not to clean under the gum, but you can use dental floss to remove any fibrous foods that get stuck between the contacts. Flossing is difficult for a lot of people. It's very mechanically challenging for a lot of people, and it's not critical. The critical part is the toothbrush and these little interdental picks. Then there is a layer of anaerobic bacteria on the top of the tongue. It tends to get very thick sometimes, and 80% of bad breath comes from the top of the tongue. To remove the excess anaerobic bacteria and the decaying food particles that are in and around the taste buds, you take a spoon, invert it, go all the way back, almost to the point where you want to gag, you're on the top of the tongue, and you scrape the tongue with the spoon forward, and this milky fluid accumulates in the bowl of the spoon. Now, if you look at last little geek, and put on your hand, and then smell it, what your bad breath smells like. So, not a pleasant thought, but if you want to get a little experimental, this is the best way to remove the excess bacteria. Now, you don't want to use antimicrobial mouthwashes. It'll kill that bacteria. But if you kill that bacteria, it's going to damage a very critical biological pathway called the nitrate, nitrite, nitric oxide pathway. Let me tell you a little bit about that. So when you eat foods that have natural nitrates, it's absorbed through the upper part of your small intestine into your blood system, and maybe 60–70% of it gets into your salivary glands. That nitrate is very biologically active, and it pours from the saliva around your mouth. The bacteria on the top of your tongue, which are anaerobic bacteria, make a chemical reaction with this nitrate and changes it into what we call nitrites. You don't even think about it, it just happens. And then you swallow the nitrites, so form nitric oxide, which is critical for cardiovascular health, control blood pressure, even gingival or gum health. Boy, this area on your tongue, a pathway, nitrate, nitrite, nitric oxide, is interrupted. You decrease oxide that's formed in your, that was published a couple years ago, a variety of to other cardiologists, heart doctors, that prescribe blood pressure medication for patient. You're not getting the result that you think you should, not on mouth. I kill the time. It's a oxide pathway, increases the amount of nitric oxide, increase blood pressure. Fascinating.
Yeah.
So clean your tongue with a spoon, remove bacteria, excess, and the decaying food. Don't kill the entire.
Great. Sorry, the connection's not great, but hopefully you can hear me, Doc. But thank you so much for that nitrate, nitrite, and nitric oxide sort of explanation. I think it's very, very important. And I do want to sort of just pivot a little bit and go into a little bit of your history of mercury and the mercury amalgams that you put in and root canals. You did a bit of research and study with regard to dentists and your type of cancer. So maybe just expand a little bit on, people are still using these amalgam fillings, they're still doing root canals, and then a little bit of research you did with, I think there was an Argentinian paper or a paper just explaining what's happened to a lot of dentists.
Yeah, very interesting. Well, the Food and Drug Administration, the FDA, year after year has a public statement that says dental amalgams are safe in humans, and there's never been a research paper that shows that it relates to chronic disease. Very sad, because so much information, and I would refer your listeners and viewers to the IAOMT, the International Academy of Oral Medicine and Toxicology. They have many papers on their website that demonstrate the horror of mercury in the body. So mercury, primarily two ways. You eat fish that are high in mercury, you get a lot of methyl mercury in the body. That's not as critical. Most people have dental fillings, mercury fillings, silver fillings. These have what's called elemental mercury in the filling that vaporizes, becomes inorganic mercury, and it's very, very toxic to the body. There are so many toxic reactions from mercury in the body, neurotoxic, biologically damaging the microbiome, affects almost every organ system, deposits in all kinds of tissues. It's a very difficult thing to get rid of. And if you have mercury fillings, it makes no sense to try to get rid of excess mercury in your body until you remove the fillings, because it's always going to off-gas some elemental of mercury, which will become inorganic mercury and literally damage every organ system and cell in your body to some extent. So my recommendation, and unfortunately, if you were to tell a person in the United States, get your silver fillings out without having extra decay around the silver fillings or the silver filling breaking down, that could cause you to lose your license. A sad state of affairs today. But I will tell you that the research I read shows to me that there's no sense to put a toxic element in your body, especially one that continues to emit its toxicity 24 hours a day, 7 days a week. So if you were to think in terms of that's not a, and you wanted to remove these mercury fillings, you need to go to a dentist who knows how to do it correctly. If you remove these fillings rapidly without action, all of this excess mercury vapor vaporizes instantly. You breathe it, you swallow it, it goes through mucous membrane tissues, gets into your blood system extremely rapidly, and it causes a acute toxic reaction. That is very damaging. You'd be better off leaving the mercury fillings than to remove them in an inaccurate way. So a biological dentist who understands how to remove these fillings will take various precautions. They'll probably have you rinse your mouth with certain binders. In this case, it's beneficial because it will bind excess mercury that may get into your mouth. They'll put what's called a rubber dam around the tooth that protects your body from the removal of the amalgam. They'll have very high filtration systems that suck up the vapor that doesn't allow it to get into the dental environment for you or the dentist or the staff to breathe. It's very, very critical things. So removing dental amalgams and having those teeth filled with new materials that are not toxic to the body, I think is the first step to remove the toxicity. If there are many areas in the body where mercury has embedded itself, it's difficult to remove. And when you try to remove it, you can remove it too fast and it creates more toxicity. Sometimes it may make sense just to have a very healthy diet, be in ketosis, allow ketones to stimulate natural glutathione production that will slowly toxify these heavy metals over a course of time. And that may make more sense than to go through an aggressive detoxification process that most people don't understand well and just shoots these mercury, embedded mercury in the bone, tissue, or whatever, and gets it into the bloodstream and creates a toxic reaction rapidly. There are ways to it, and you have to use, you have to look into the medical profession who's doing it regularly and understands that it takes a long time to do it, and it has to be done very carefully.
Great, thank you so much.
That's one thing.
Hopefully the mercury is going to become a thing of the past, but it's still being used routinely here
It's not. It's not. In the United States, dental schools still teach students to put mercury. So I don't know when it's going to stop, but they're still teaching students to do that.
Sure, that's not good.
And the other problem, no, it's not. The other problem is root canals. Now, a root canal, I will agree that there may be a chance that a root canal filling in a one-rooted tooth, like a front tooth, could work, might work, if the tooth was fractured. Let's say you were in an accident and you broke your front tooth almost the gum line, and it's actually damaged the nerve of the tooth. But the tooth is not infected at this point. It just was fractured. If that's a horizontal fracture, the crown fractures off, but you still have this solid root, no gum disease, no other issues other than this fractured tooth. Very possibly a very well done root canal using maybe ozone, using laser treatment to make sure that that canal is cleaned out thoroughly and filled absolutely correctly, that tooth root might survive, and you could put a crown on that tooth and save the tooth. That's a possibility. But in my opinion, and from my experience and some of the research that I read, just recent stuff, when you have a root canal, especially when there's been an abscess, infection that's leaked already, or multi-rooted teeth, like the molars, the lower molars have 2 roots, the upper molars have 3 roots, some first bicuspids have roots. These are very difficult to negotiate from a dental standpoint. Some of these, what's called accessory canals, little small canals that move laterally and go from the to the bone, are never thoroughly cleaned out. They have residual infection, creating inflammation in the bone. That inflammation stimulates the immune system, creates an active reaction that is 24 hours a day, 7 days a week, weakening the immune system. It also allows the chemicals, the cytokines, and certainly the inflammation as well as the infection bacteria to penetrate the blood vessels, getting into the blood system. It allows all of this to get into the lymph that eventually gets into the blood system. And even more importantly, which is not understood very well, it allows chemicals to get onto the myelin sheaths. These are the coatings of the nerves, like the plastic wire, and they just slide along these myelin sheaths to all the areas these nerves innervate and getting throughout the body. It can communicate to every and any organ in the body, creating all kinds of chronic diseases. And it doesn't have to happen right away. It can happen weeks, months, years, even decades later. So root canals that have the potential to leak most frequently need to be removed. The teeth need to be extracted. The canals have to be cleaned out thoroughly. And then the bone may be rebuilt to do implants or bridges or partial dentures, or if the tooth is not functional, maybe not even replaced.
Great, thanks, Doc. I don't know what your thoughts are on that documentary, Netflix documentary that was pulled off called Root Cause.
Yes, I saw that.
Yeah, 97% was stated of all breast cancer patients have a root canal on the same side. Obviously, we don't know if that's causative or correlative, but just tell us a little bit about your thoughts regarding that, cancer-causing possibility.
Well, you aggravate the potential for cancer because it's compromising the immune system. Is actually there not only fight from the outside, fights invaders from the inside, like cancer cells. You and I cells every day week. We cancer cells, those cancer the chemistry trigger that to happen so that your body doesn't have to deal with a malignancy, or your immune system senses these cells and they after those cancer cells and they gobble them up and destroy the system to do that.
Right.
Inflammation from what it can cause and hamper and maybe it's a progression of cancer. So in this case, like a tooth that's infected and relates, let's say, breast cancer, the Eastern, the meridian effect, my thought is that the meridians are actually the fibers that go from the tooth area to different organ systems, and this infection and the inflammatory response that slides on island sheaths penetrate other organ systems on it. So let's talk about this study. I'm very geeky, and I needed to understand why I had multiple myeloma, because I was eating a paleo diet for 6 years before my diagnosis. I thought I would be very healthy. How could I have myeloma? Well, so this study that was done, I think it was published around 2010. This study looked at the male population of dentists aged 65 to 75 compared to male population 65 to 75 in general. And they found, it's an observational study, they found that that male dental population, 65 to 75 years old, had a higher prevalence of cancer, especially multiple myeloma, compared to the general male population, that age group. So the study didn't say why they had cancer, it's just an observation. So I'm thinking, what happened in my dental training, 4 years of dental school, 2 years of graduate periodontal school, that was different from the male population? Now, I knew that conventional medical science says that malignant plasma cells occur from low-dose ionizing radiation. Well, low-dose ionizing radiation are dental x-rays. So when I was in the dental clinic, 4 years undergraduate school, 2 years graduate periodontal school, 6 continuous years, I was exposed to dental x-ray machines throughout the clinic all the time. Now, I had no idea when they were on or off. They don't make a sound. They don't make an odor. There's only a light that goes on and off. Who knew how often I was walking around the clinic getting a little exposure here, a little exposure there? And maybe one plasma cell was affected in such a way that my immune system didn't kill it, and it didn't kill itself off, and it started to overgrow, which would be a malignancy. And it could take 40, 50 years to manifest. That's a possibility. The second thing is, I know that we used elemental mercury, free mercury, to make dental amalgam. And we literally played with mercury in our hands like kids play with Play-Doh. You know, this silvery, wonderful ball of mercury that would run around. We'd throw it on the floor. It would dance around and vaporize the entire dental clinic in the United States, all dental schools. Everybody did it. They threw the excess mercury on the floor. It vaporized, got into the air. We breathed it. So we were probably toxic with mercury as well as low-dose ionizing radiation. What a terrible combination of toxic, cancerous material. I think that's what happened to me. That's what happened to some medical or dentists in this study that showed that dentists had more prevalence. And at the age group is just that it took that many years for the malignancy to manifest. That's the problem.
Obviously, the
I
standard
don't know.
American diet made it sort of, didn't help your body deal with
Probably,
that.
sure, because I didn't know anything about toxicity.
Yeah.
I didn't know about eating healthy. I didn't know what my body could detoxify on it if I was in ketosis. I mean, I didn't know a lot of stuff. Now that I know what I know, if I went to dental school to definitely be on it, I would definitely watch my toxicity levels. I would definitely, if I was in a dental environment, wear a badge to see how much radiation could be leaking out to me. I certainly would never use mercury. I mean, this is what I know today. A little too late, but this is what I know today. But this is why I think that I got cancer. And, it's a lesson to be learned. I think that this, from a spiritual sense, I think that this was my lesson in life. I've gone through a lot of stuff, but this devastating occurrence when I was 71 years old could have ended my life, but it didn't. And I think the lesson I learned, the spiritual lesson I learned, was that I needed to get healthy naturally, or most naturally as possible, and spread the word that if you are in a health crisis like a cancer scenario, a life-death situation diagnosis, don't necessarily go with the chemical interventions. Do some research, get your body healthy, have the right attitude, fix a lot of stuff. We talked about metabolic flexibility, and the gut is another critical element we really didn't talk about, but I specifically do things to my gut to create significant variety of microbes to help offset pathogenic bacteria. It's called alpha diversity. I've been tested for my alpha diversity. I'm in the 98th percentile for alpha diversity, which is amazing. That means 98% of healthy people have less bacterial diversity in their gut than I do. And that's critical because more species will crowd out bad species and support a robust immune system, which is the essence of health, the robust immune system. But another thing that I do, which is another very critical element, is I support my mitochondria. Certainly a diet of ketogenesis will support mitochondria. Good exercise supports mitochondria. But there is some therapy called pulsed electromagnetic field therapy, which stimulates the cells. It creates frequencies that are communicating to the cells. Every cell in our body is electrical. It creates its own frequencies. It talks to one another by cytokines, but also by frequencies. And sometimes these frequencies weaken and the cells become weakened, almost like a battery that runs down and becomes weaker and a flashlight dims. So we can support our mitochondria, and cancer is a disease of mitochondrial dysfunction. So we can support this mitochondria not only by diet, not only by exercise, but by stimulating and recharging these cells with pulsed electromagnetic field therapy. And I have a mat that is in my bed. It's like a yoga mat that's under my sheet covers, and that mat actually generates these frequencies, hundreds of frequencies in low frequency range in a harmonic balance that stimulates all kinds of cells in my body. And I use that mat 3 times a day, and I think that's another element in my protocols that supports my body's immune system and health to help treat my cancer.
Right. Do you have a sort of brand that you use that I can put in the show?
Yes, actually, absolutely. I use a brand that is imported from Germany through a company in the United States called Pure Wave Now, purewavenow.com. I can't remember the exact name in Germany, but this is a mat that has been researched for over 20 years. Now, there's a lot of pulsed electromagnetic field mats on the market. Most of them only generate one frequency or a couple. This generates thousands of frequencies in the ranges that are compatible with human cells. And it's done in a very harmonic balance of pulsing, and it has filters that filter out 50 to 60 hertz frequencies that have voltage spikes. These are very critical frequencies that can damage the pulse electromagnetic field. So this mat has all these filters. Other mats don't, and they have these voltage spikes that damage the frequencies of pulse electromagnetic field. So this mat is pretty effective. I've done a lot of research. There's a lot of mats on the market. Like I said, this is the best one that I can find. And it's from purewavenow.com.
Great. We'll link to that in the show notes. Doc, tell us about your 5 tips to a robust immune system. Obviously, looking at C19, you told us about mapping the GI tract and how important that is. What are the other 4 that you focus on and have helped you with your whole process of health?
Well, number 1, you have to have a healthy mouth, because if you have any gum bleeding, it is indicative of a depressed immune system, and we need to make sure that immune system is strong. So I have a method of how to clean your mouth. We talked about it a little bit. I have a little PDF called 4 Steps to a Healthy Mouth. That's critical, and cleaning between the teeth with these little TP brushes are very, very critical. If you have bleeding in the gums and it doesn't go away and it's infection under the gum, it needs to be treated by a good biological dentist or a periodontist who's a specialist in treating gum disease. But you must treat the gut as well as the mouth, or you won't treat the mouth effectively. So bleeding of the gums is a sign of dysbiosis and compromised immune system. The other, like we said, metabolic flexibility with ketones. I use a ketone meter to know that I'm in ketosis. The third is glycemic variability. There are some very excellent peer-reviewed medical articles in medical journals that show that glycemic variability is critical to predict chronic disease. Now, glycemic variability means your ability, your insulin's creation to metabolize the carbohydrates that you're eating, take that glucose and either use it as a fuel, or store it in as glycogen in your liver and muscle, or store it as fat in fat cells, and to get it out of the blood system rapidly and efficiently. And if it's doing that, the glucose level just rises a little bit and falls a little bit, and that's called glycemic variability. When that glucose rises very, very high and drops very, very quickly or slowly, that variability, that steep up and down curve, increases glycemic variability. And the research shows that a higher glycemic variability over time predicts higher risk to chronic disease and cancer, and also predicts a lower efficiency of your immune system. In other words, you want to have, whenever you're eating carbohydrates, your insulin levels should be such that it does not cause this spike in blood glucose, leave it high for a while, and then drop it rapidly and move back and forth in a very high fashion. You want the standard deviation of your glycemic variability to be as low as possible. So some of the research suggests that the goal is to have your standard deviation over a 2-week period of time to be less than 20. If it's less than 14, it's ideal. Mine is 10. It's amazing. And the way to check your glycemic variability, you could stick your finger 24 times a day, which I'm not going to do, or you can wear what's called a continuous glucose monitor. What a fantastic device. It's a little disc that sits on tissue like your under part of your arm or on your belly where it's inconspicuous, and it's not bumped very often. And what it does is this. It has a little prick that when you put the monitor on, inserts a tiny microfiber into the tissues of the belly or the under part of your arm. It reads the interstitial glucose 24 hours a day, 7 days a week. It doesn't go into the blood vessel, but it reads the glucose that filters out of the blood vessel into the tissue. It's very accurate. And it reads that maybe every 10 minutes of every day. and it records it in its database on a phone or the company that's providing it, and you'll get a graph of how your glucose fluctuates all the time. When you're sleeping, when you're exercising, when you're eating, you'll know what you do and how it affects your glucose. And the data actually computes the standard deviation. And you get a standard deviation day by day or week by week, or the glucose monitor only functions for 2 weeks. You'll get a standard deviation for that entire 2-week period. That average standard deviation for 2 weeks is critical to know how healthy you are. So one of those biomarkers for a robust immune system is to have a low standard deviation that is recorded with a glucose monitor. The other biohacker that I use is your vitamin D level. There is so much talk about vitamin D and COVID, but vitamin D supports so many functions in your body and your immune system. And you want to test your vitamin D level by doing a test called 25-hydroxy vitamin D. This is inactive vitamin D that's in your blood system as a reserve before it becomes activated. And this should be in the 40 to 60 nanogram per milliliter range. Now, as a cancer patient, I'm looking at a little higher range, 60 to 80, and mine has been in around 70 nanograms per milliliter. I am not in the sun very much, although I would love to be, but I'm not. So I do take vitamin D3 as a supplement, and you need to take vitamin K2 in addition to make sure that calcium is metabolized correctly from the vitamin D. And that is what I take. I take 5,000 international units a day. I'm actually experimenting right now, and I'm trying. There's some research that suggests that a very high vitamin D level may be very beneficial for my multiple myeloma cancer. So I am experimenting. I told you I'm an N equals 1. I'm a little guinea pig. I am starting, and this is, I'm not recommending this to anybody. I'm just telling you what I'm doing. I am taking 20,000 international units a day. I'm taking about 400 micrograms of K2 a day. And I am going to see how my dysfunctional antibodies, I have dysfunctional IgA antibodies because of my multiple myeloma. In maybe 3 months, I will test those dysfunctional antibodies again to see if it's really getting reduced from the very high dose of vitamin D3. If that's the case, I'm going to write about it and put it in my blog. If it's not the case, I might write about it and tell you that it's not a good idea to do. But I'm going to do it. I'm not recommending it to anybody, but there is some research that I found that suggests that it's good for my type of cancer. So why not?
Right. We look forward to that vlog for sure.
Yeah. And then the fifth biomarker is my diversity of gut microbiome. This is very interesting. There are studies that show, and this is just a few years ago, there are studies that show that if you are on an animal-based diet exclusively, there are certain species that are dominant in your gut. It also shows that if you change from an animal-based diet to a plant-based diet, within 24 hours, those species change. And then if you go back to an animal-based diet, within 24 hours, those species change. But the most important thing is that these species will use fiber to ferment short-chain fatty acids, which are critical, but they'll also ferment amino acids from the animal-based diet to form the same short-chain fatty acids. So fiber is not the critical thing. The food for the bacteria is the critical thing, and the different diet creates different species. But the most important thing is to have a huge variety of species in your gut and many, many numbers of those species, because in primal societies that have had their microbiomes examined, and these societies don't have chronic disease or gum disease or tooth decay, they have a huge variety of species in their gut. This is called alpha diversity. There is a new gut test that is created by Microbiome Labs called Biome FX that is read by a company called Cosmos ID. Cosmos ID is an international company that has probably the largest database of microbes, and they do full genome sequencing or whole genome sequencing, looking at the entire DNA of the microbes. So they have a very, very accurate picture of the microbes. So I had that test done last year, June or so of 2020, and my alpha diversity was 98%. That means I'm in the 98th percentile. That means that 98% of healthy population have less variety of species of bacteria than me. And that means that I have the potential to really offset pathogenic bacteria in my gut and have a very healthy gut. I do believe that's a critical element. So those are the 5 biomarkers that I think are very interesting to know to support a robust immune system. No bleeding in the gum tissue, being on a ketogenic diet, creating ketones in the body, having a low standard deviation of glycemic variability, having a vitamin D3 level, 25 hydroxy vitamin D level of 40 to 60 nanograms per milliliter minimum, and that's a blood test. And then also having a very significant diversity of bacteria in your gut, meaning an alpha diversity as high as you can possibly get it. And I do that with spore-based probiotics, which are the only probiotics that survive stomach acid and regerminate in the gut.
Great, fantastic summary. We'll link to that. I know it's on Dr. Al's website because I've had a look at those 5 important markers. Dr. Al, tell us about measuring sleep. We haven't spoken about sleep or electromagnetic radiation or just your light diet. Are these 3 factors something that you look at?
Absolutely. So I do exercise. I think exercise is important. I have very limitations of exercise. So what I do is when every day, unless the weather is not conforming for me to go outside, I walk about a mile a day. I use a rollator, fancy kind of walker, so that if my legs give out, I'm not going to fall and break other bones. So I do that. I do modified squats in the house, and I do modified push-ups, even though I have a broken right humerus. I have 2 broken femurs, but I'm all splintered together, and I do what I can do. So exercise is critical. Sleep is very important. I don't have any problem sleeping. I get at least 7 to 8 hours of sleep every night. I sleep very well. I do get up maybe once in the night to go pee, but generally I do really well. I contributed that to not only my diet, but a healthy gut microbiome, but also my pulse electromagnetic field therapy, and I'll tell you why. So my pulse electromagnetic field therapy, I use 3 times a day. And my pulse electromagnetic field therapy protocol is something that I've tweaked over the last couple of years. And I have this protocol that really invigorates my mitochondria first thing in the morning, in the middle of the day. But at night, I set it at a setting that stimulates my parasympathetic system, that allows me to relax. And I think that definitely helps with sleep as well as my body repair itself. So sleep is critical. I think the pulse electromagnetic field therapy, it supports everything else that I told you about with mitochondria, cell membrane, and actually pain. My pain, I live with pain all the time. I do not take anything for pain except occasionally an ibuprofen if it's really bad. Now, I know from my tweaking of the pulse electromagnetic field protocol that I used to have a lot of pain, very, very annoying. When I'm using the protocol I use now, I have very tolerable discomfort. And that, I think, is definitely attributed to my pulse electromagnetic field therapy. That's why all these protocols, I think, are very supportive for my body's ability to heal and support a robust immune system. I cannot tell you anyone is most critical. Certainly the immunotherapy is the medical conventional medical side of it, but all the others are unconventional. Now, there is some research. This is very interesting too. There is some research in the oncology journals that describes immunotherapy. Only 25 or so % of patients that are accepting immunotherapy, they are their body will accept immunotherapy are only successful. Only 25 or so % are successful. The other 75% that are not successful most likely is due to dysbiosis in the gut, according to these articles in oncology journal publications. So the medical profession is slowly understanding that gut dysbiosis is critical for conventional oncology, especially immunotherapy, to work better. And I think that that's another reason why my immunotherapy could be enhancing my body, only because I have such a healthy gut microbiome.
Fantastic. And Dr. Al, I thank you for your time, your expertise, just how you've shared your story. Obviously, you're a man who's just dedicated to teaching, sharing content. And I do have one last question that I ask all my guests, because it's something that I sort of struggle with just the common person out there, that people battle to maintain lifestyle habits, sustain transformation. Often they've got to wait for a stroke, or they've got to wait for cancer, or they've got to wait for a spouse to get an autoimmune disorder. What are the key factors or piece of advice that you can give people to maintain lifestyle habits or maintain their sustained transformation before they end up with a chronic condition? Because people are trying to cure disease instead of prevent disease. They, waiting for the ice to sort of break and then realize, hang on, you know what, now I've got to fix things. Or people now that realize with COVID-19 that actually I'm, metabolically, not good. So what can I do now? And then 6 months later, they're back to their old habits. So what would you say to a young person who's, doesn't have any chronic conditions to adopt these things and maintain them?
The sad thing is, I can tell anybody and everybody the facts, and they're going to understand the facts, but they're not emotionally involved, so they're going to ignore the facts. That's really sad. Now, there are a few people that just understand the facts and say, I'm going to make a change because it makes sense. Someone generally has to have an emotional reaction before they do something for themselves. People, for example, if they get married, all of a sudden they're emotionally involved with the marriage and they want to change their way of living. Maybe they have a child and they want to see their child grow up and they change their emotional way of living. Somebody might have a grandchild and they want to see their grandchild become an adult. So they know they have to change their way of living. They have maybe a health-threatening event like a stroke or a heart attack, and they survive. They definitely have an emotional reason to make a change. I can't tell a person what that emotional reaction is to make sense enough to make a change. I will tell you, though, that I am a perfect example of a person that has been literally at the edge of death. I mean, I was in hospice. If the hurricane did not come through Charleston, I was going to die at the hospice hospital, and it would have been over. I gave up. I gave up because I thought I had nothing else to live for, because my quality of life was over. People need to know that they can make a change proactively if they are metabolically flexible. That means they need to educate themselves as to the diet that our primal ancestors have evolved with for at least 160,000 years. So you got to understand, these modern type way of eating, like a vegan or a vegetarian, is not the way the human species has evolved. There's never been a vegan society that has thrived. Vegans thrive today, but they thrive today because they're on many different supplements that are required by their body, or they will not survive. any vegan is healthier than a person that's on a standard American diet. So if you're comparing a vegan diet to the crappy diet that everybody is eating, yeah, vegan is okay. If vegan is supported by supplements, it's okay, but it's not natural. If you want to be healthy and you want to look at the human experience, understand how we have evolved, understand our DNA code, our DNA blueprint that requires us to eat certain foods because we don't have certain enzymes to digest anti-nutrients, for example. And we need these animal proteins and animal saturated fat and animal organs where the nutrients are and animal collagen. You will be metabolically flexible. You'll be in ketosis for a good period of time. Your body will cycle in and out of ketosis and natural carbohydrate burning fuel. And you can ward off potential chronic disease, including cancer. It's a big statement, but this is the way our species has evolved. So if I could impress anybody to do anything, it's to understand what metabolic flexibility is, how to get there, how to eat that right diet, and do basically an animal-based diet with some fruits, some vegetables maybe that are low in phytates or oxalates and lectins. Definitely raw honey if you want some sugar. That's a very, very fantastic food, and it is animal-based, and I do use raw honey. So I would recommend that. Of course, other things, you have to control emotional stress, you have to exercise, you have to sleep well. There are a lot of factors to be human and to be healthy, but certainly metabolic flexibility is critical.
Thank you so much. Where can people connect with you, Dr. Al, and where they can get your content? Let's give us your social media handles if you do have any.
Certainly. So I am at drdanenberg.com, DRDANENBERG. I'm on Instagram. I think, I can't remember. I think it's Dr. Danenberg. Twitter at Dr. Danenberg. Facebook, Dr. Danenberg, Dr.Danenberg, I believe. You can Google me. I'm everywhere, I think. But definitely at my website, because my website has quite a bit of material there. It's a contact form where you can send an email. It comes directly to me. I answer all my emails. I have links to doing some consultations. I do consultations all over the world, individual consultations for just an hour and a half. I do a 12-week coaching program, a variety of things. But everything that's on my website can be downloaded, and all of that is free.
Fantastic. Well, I salute your calling and your purpose, and just you teaching, other practitioners coming on the podcast. I think there's a lot of value, and I'm going to share this on the podcast and slice it up for social media. So thank you so much. I wish you well, and I wish you health and a health span, because you've committed to that. And I think you're leaving a legacy of, hopefully dental practitioners that are coming to study nutrition. I know you run a certified functional nutritional program for dental practitioners and oral hygienists and that. So thank you so much. And I look forward to many, many years, and hopefully we can come have you back on the show as the periodontist specialist. So thank you so much.
It's my pleasure. Thanks for the opportunity. It's been fantastic.